Hello and welcome to the Drug Policy Facts podcast for March 25th, 2014. I'm your host, Doug McVay, editor of Drug War Facts and drugwarfacts.org. This week's edition is number 20 in the series. The Drug Policy Facts podcast is brought to you by Common Sense for Drug Policy and is hosted through podcastgarden.com. The URL to listen or subscribe is podcastgarden.com/podcast/drugwarfacts. You can find Drug War Facts on the web at drugwarfacts.org. You can follow us on Twitter, where we're at Drug Policy Facts. Also check us out on Facebook and give the Drug War Facts page a like. Share it with friends. We are currently being heard at 420radio.org on Tuesdays at 8 a.m., Wednesdays at 11 p.m., and Saturdays at 8 a.m. If you're listening via 420 Radio, thanks! If you enjoy the content, subscribe, and check out our website at drugwarfacts.org. The Drug Policy Facts podcast is brought to you by Common Sense for Drug Policy. We do these podcasts as a free public service. We also allow these podcasts to be retransmitted without fees. If you're interested in licensing or syndicating our content, you can get in touch with me through the website at drugwarfacts.org. This week is part 2 of a 2-part special covering the 57th annual meeting of the UN's Commission on Narcotic Drugs. The Commission on Narcotic Drugs is charged with monitoring compliance with the international drug control treaties. It also oversees the UN Office on Drugs and Crime. From March 12th through the 21st, drug control authorities from nations around the world, along with representatives from dozens of non-governmental organizations and UN agencies, met in Vienna, Austria for the Commission's 57th annual session. Last week, I gave you some background on the CND and the Vienna Non-Governmental Organizing Committee, or VNGOC, VNGOC, and we heard from a couple of national delegates and a Deputy Secretary General of the UN. This week, we'll hear more from civil society and UN agencies, and we'll look ahead to the UN General Assembly Special Session on Drugs being planned for 2016. Before we begin, I want to mention I produced these reports on CND 2014 in cooperation with the Drug Truth Network. DTN is based in Houston, Texas, and most of its programming is produced at the Pacifica Network's radio station there, KPFT-FM. I'm a contributor to DTN. For several years, I've written and produced my own segments for them, and in the last 2 weeks, I've guest-hosted one of their flagship programs, Century of Lies, which have also been devoted to this year's CND. You can find a lot of excellent content at the DTN website at drugtruth.net. Check it out sometime. So now, let's get to it. Thanks to the VNGOC, the voices of civil society have been getting heard at international levels. Let's hear first from Eliot Albers, representing the International Network of People Who Use Drugs, or INPUD, speaking on the 12th before the VNGOC.
Our next speaker is Mr. Eliot Albers, who is representing the International Network of People Who Use Drugs. Please.
Thank you. I'm especially pleased to be here in that the community most severely impacted upon by repressive drug law is being given space to speak in this forum. We've heard a lot about health, and I very much welcome that. It's about time that we started to hear about health in Vienna. I want to talk about rights. I want to talk about human rights, and I want to talk about the relationship between abrogations of human rights and drug control law. Over the last few years, it's become increasingly widely recognized, at least in some circles, that two bodies of international law, namely human rights law on the one hand and drug control law on the other, exist in what have been called parallel universes. Professor Paul Hunt, when he was UN Special Rapporteur on the right to the highest attainable standard of health, made this comment in a report in which he also noted that this widespread systemic abuse of human rights is especially shocking because drug users include people who are the most vulnerable, most marginal in society. Despite the scale of the abuse, despite the vulnerability, there is no public outrage, no public outcry, no public inquiries. On the contrary, the long litany of abuse scarcely attracts disapproval. Sometimes it even receives some public support. And that indeed was the finding of a report done by our Australian member organisation, who found that for many people, stigmatising people who use illicit drugs was in fact a positive thing. To be explicit then, the pursuit of repressive drug control in the name of the war on drugs has inexorably driven rampant human rights abuses against people who use drugs and their communities. That one set of international laws is systemically driving breaches of another is an increasingly untenable situation. Whilst there is no hierarchy of legal systems, it is arguable that human rights law and the principles upon which it is based, principles that are defined as indivisible, inalienable and universal, should unequivocally trump the pursuit of another set of laws that are producing such gross rights violations. When the pursuit of drug control law becomes a driver of widespread human rights abuses on what is unquestionably a massive scale, it is without doubt time to call for a thorough review of those laws. As the Global Commission on Drug Policy put it in their report looking at hepatitis, instead of investing in effective prevention and treatment programs to achieve the required coverage, governments continue to waste billions of dollars each year on arresting and punishing drug users. A gross misallocation of limited resources that could be more efficiently used for public health and preventative approaches. At the same time, repressive drug policies have fueled the stigmatization, discrimination, and mass incarceration of people who use drugs. This passage makes clear the mechanism by which repressive drug policies drive and produce violations of the human rights of people who use drugs. That the pursuit of drug control, the maintenance of what has been called punitive prohibition, and the war on people who use drugs is indeed driving such breaches is now, I think, beyond question. When you define the pursuit of public policy, defined by both national and international law, as a war, you are going to produce war casualties, and arguably unintended, and in this case decidedly negative consequences. In response to this war, we are calling for a peace. We are calling for an amnesty for drug war prisoners, an end to the violence and rights violations that have been heaped upon our community, and we are calling for an intelligent and open debate on alternatives. The state of war in which we are living is one waged in the name of morality, of social order, and in defence of the rights of the state to control the bodies of its citizens. It can no longer be claimed that human rights violations occurring in the name of the war on drugs are aberrations. They are rather a logical consequence of the pursuit of this war. As such, we call upon the human rights community and society at large not to remain silent, but to join us in calling for an end to the war on drugs, an end to the war on our communities, and an end to the endemic stigmatization, marginalization, discrimination and structural violence that it has entailed. These conditions have fostered an environment in which people who use, and in particular people who inject drugs, have suffered from systemic denials of their rights to health, to privacy, to integrity of the body and mind, and to be free from discrimination, torture, cruel, degrading and inhuman treatment, and to liberty. The deep stigma that people who use drugs are subject to has seen us denied access to appropriate healthcare services, including access to sterile needles and syringes, opioid substitution programs, and treatment for HIV and hepatitis C, to education and the right to vote, denied the right to enter, stay and reside in numerous countries, has seen us fly into jails, prisons and forced detoxification centres that are nothing more than forced labour camps. It has seen us denied access to our children and subject to corporal and capital punishment. All of this for what is in reality a victimless crime. For we would argue that what drugs an adult chooses to use should not be the business of the police or of judicial authorities, or of that of any other agent of the state. That it has become so has fueled an epidemic of imprisonment, incarceration, denial of appropriate medical care, and ill treatment that defies and makes a mockery of human rights norms. The extent of the human rights violations to which people who use drugs are subject is extensive. Beyond the criminalisation of drug use and possession, which is in and of itself a legally enshrined violation of the right not to be interfered with or to privacy, in terms of what drugs one chooses to use, these violations range from and include the hundreds of thousands of actual or suspected drug users thrown into drug detention or rehabilitation centres in Southeast Asia, in which torture, forced labour, abuse, violence and degradation are the norm. The prisons in the USA, in Russia and countless other countries that are filled with non-violent drugs offenders, with a disproportionately large number of those in the USA being people of colour, African Americans and Latinos. Denial of access to healthcare, most notably denial of access to HIV and for hepatitis C. The denial of our agency and ability to make decisions about our well-being and arbitrary police violence and harassment. The war on people who use drugs has fallen most heavily on ethnic minorities, the poor and women who use drugs. These multiple markers of stigma and exclusion have fueled, as I said, mass incarceration, sometimes forced sterilisation, police victimisation and violence, and they have actively driven the twin epidemics of HIV and viral hepatitis amongst these sectors of our community. This tidal wave of flagrant, systemically driven human rights abuses must be brought to an end, and the only way to do so is to attack the problem at its root. In this case, this means calling for a thorough overhaul of the 3 UN conventions that together comprise the global regime of drug prohibition. Superficial redress and minor reform or tinkering will not staunch the flow of systemic rights abuses that I have described, that are directed at people who use drugs, their families and their communities. Only the end of the war on people who use drugs through international legal reform will suffice to end this panoply of rights violations. To ensure that this will end, we are calling upon human rights defenders and advocates to join with drug user activists, harm reduction and drug law reform advocates in working to ensure that the architecture of global prohibition is firmly on the table at the UN General Assembly Special Session on Drugs in 2016. Thank you.
Now, here's Doug Fine, the author of Too High to Fail, speaking on a panel and delivering a message from the European Coalition for Just and Effective Drug Policies, or INPUD.
Thank you, Madam Chair and distinguished delegates. This statement is presented by INPUD, a European platform of organizations and individual citizens who are affected and concerned by current drug policies and who aim to replace them with policies that are more just and effective. Thank you, Madam Chair and distinguished delegates. This statement is presented by INPUD, a European platform of organizations and individual citizens who are affected and concerned by current drug policies and who aim to replace them with policies that are more just and effective. My name is Doug Fine. I'm a drug policy author who, as a father and as a reporter, has become convinced that the international drug war must change its focus. I should also add that today I'm replacing at the last moment Joop Omen, a longtime and respected drug policy activist whose credentials were stripped this morning. And please see NCOD's press release on this. They've got copies printed out for you. Now, listening to the distinguished delegates' statements during this session, I recognize that many well-intentioned efforts continue in an effort to protect public safety. Nonetheless, according to UN's own figures, a realistic estimate for the global turnover for the total illicit drug industry amounts to somewhere around $400 billion per year. That means that every second, $12,683 changes hands worldwide through the sale of what is today illegal drugs. Since the production cost represents such a small, tiny percentage of this amount, it's obvious why the illicit drug trade is a key engine behind organized crime and widespread corruption worldwide, and why the bulk of the revenues from the illegal drug trade is not benefiting simply warlords or local drug barons in producing countries, but rather otherwise legitimate Western world financial interests. And that, in a sentence, sums up the effects of international drug policy since the 1961 convention went into effect. This is why member states like Uruguay, Portugal, and more individual U.S. states are unilaterally changing drug policy. Individual states' legal regulation is the only way to increase public safety and reduce crime surrounding all drugs. I can tell you this from years of field research, that this is true. I must respectfully disagree with the opinion that use goes up with legalization. Multiple studies in the U.S. After legalization and in places like Portugal relatively uniformly indicate that in fact use stays either close to the same or goes slightly down, especially in areas as a father that I'm concerned about, which is youth use rates. Anyone who studies drug policy eventually wonders who organizes organized crime. Is it the small-time criminal who benefits from the fact that commodities millions of people want to use continue to be prohibited? Or is it also those who insist, against all evidence, on the illegality of drugs and enable easy and large profits to be made by all kinds of black market entities, often using the banking system to launder money and thus attack at the very democratic roots of society? I'm speaking here for 180 seconds. In that time, the international drug trade has generated 180 times 12,683 US dollars. That's 2,283,000 US dollars. When this important UN Commission on Drugs session is over, that figure will be 9,862,300,800 US dollars. The world drug war is not working. Please, members of the Commission, be brave, be truthful, understand that we must change strategies now. The 3 conventions on narcotic drugs must be reformed and updated to reflect both reality and better policy. The people of the world increasingly realize this. The UN must proceed along the most effective route to ending drug prohibition, namely allowing regulation by member states. Again, as a father and as a journalist who has studied drug policy from the field for the past 5 years, I can say without hesitation that this is the single most effective policy move we can take to immediately make the world a safer place. Thank you.
UN agencies tasked with responsibility for public health and human rights are outspoken in their opposition to ineffective drug war strategies. Let's hear now from UNAIDS and the UN's Office of the High Commissioner for Human Rights.
And now I would like to invite Ms. Alison Crockett will deliver the statement on behalf of the Executive Director of the UNAIDS. You have the floor.
Thank you very much, Mr. Chair, and I will be delivering 2 interventions, one on behalf of Ms. Navi Pillay, who's the High Commissioner for Human Rights, and this one is from Michelle Sidibe, my Executive Director of UNAIDS. So thank you, Mr. Chair, and amazing progress, you'll be glad to know, has been found in the AIDS response after 3 decades. We've seen amazing progress. Today, almost 12 million people with HIV are accessing life-saving treatment. Drug regimens have been simplified, the price of antiretroviral drugs has dropped, and antiretroviral treatment is easier to take and adhere to. AIDS-related deaths continues to fall, although not for injecting drug users. Major reductions in new HIV infections in almost all parts of the world have occurred, except for 2 regions where transmission is dominated by injecting drug use. But we cannot achieve an AIDS-free generation unless and until we reach the most marginalised with effective, compassionate services and policies. Calls to make the end of AIDS a goal for post-2015 era will be pointless if we cannot halt and reverse the HIV epidemic amongst people who use drugs. And Mr. Chair, the latest data does not give us hope. In 2011, all Member States agreed a bold commitment in the UN General Assembly High-Level Meeting Declaration to reduce HIV transmission of HIV among people who inject drugs by 50% by 2015. Today, we are afraid that this is one of the only targets we will miss, with grave consequences for the global AIDS response and our mutual accountability. We cannot prolong inhumane policies that divide people into groups that are deserving and undeserving of our help. We need to convince policymakers to fulfil their commitments. Mr. Chair, the magnitude of the problem, as we are all aware, is significant. Globally, at least 158 countries reported injecting drug use, and 120 have reported epidemics of HIV amongst people who inject drugs. 13% of them are already infected with HIV, and more than 60% are also living with hepatitis C. Although people who inject drugs account for only 0.2 to 0.5 of the world's population, they make up approximately 5 to 10% of all of the people living with HIV. But, Mr. Chair, we're still trying to measure this, all our progress, in the dark. If we take the 4 largest countries representing 45% of the global injecting population, we have only data from 2, China and Brazil. Without data from Russia or the United States, it's difficult to make accurate global estimates of our progress. Mr. Chair, the time for debate is over, and it is time to act. It is the mandate of UNODC to implement the WHO, UNODC, UNAIDS comprehensive packages for services for people who take drugs. These include 9 essential services, including needle and syringe programs and opioid substitution therapy. We know they are effective in halting the epidemic among people who inject drugs. We have all the data to demonstrate that in combination with antiretroviral therapy, these services reduce HIV transmission, decrease mortality, reduce crime and public disorder, and improve the quality of life for those people affected. UNODC is working with countries and many partners and states.
والعديد من البلدان تتجاهل النتائج والأدلة، ولذلك فإن هذه المشاكل لا تتناول بنجاعة، ومن غير المقبول أننا
Many countries, less than 1% of people living with HIV who inject drugs have access to HIV treatment. In an era where HIV should be a chronic, manageable disease, this is a scandal. No country should neglect the commitments that they have unanimously agreed to in the UN General Assembly in 2011. We cannot allow people who inject drugs to be punished, abused, forgotten, or left behind in our goal to end AIDS. This is not just a public health issue. This is also an issue of human rights. And this is why the UNAIDS Joint Programme issued a formal statement in 2012, for instance, calling for the closure of compulsory drug detention centres. The very existence of such centres represents a violation of human rights. They threaten the health of detainees and contribute to the spread of HIV and tuberculosis. Despite this call, we are concerned that several countries continue to maintain such centres. We in the HIV response have worked hard for decades to end mandatory HIV testing, as it constitutes a serious violation of human rights. Mandatory drug testing is equally unacceptable, and as such we would call to Member States to end mandatory drug testing. It is not effective in reducing the demand for drugs, nor is it cost effective. Indeed, it only drives people who use drugs further underground, out of reach of life-saving information and services. In addition, we add our voice to those who have already spoken at this session to call for an end to the death penalty for drugs offences. Mr. Chair, the criminalisation of millions of people for minor drug offences exacerbates vulnerability to HIV infection and does little to protect society from the health and social harms caused by drug dependence. Such punitive approaches have only filled prisons around the world. In jail and prison, people are even more vulnerable to infection of HIV and tuberculosis and hepatitis C. Punitive law enforcement clearly undermines the HIV response. When the possession of a syringe and even traces of amounts of drug is considered to be drug possession, health workers struggle to engage meaningfully with injecting drug users. Where police compensation and performance is based on the number of arrests, police often target health facilities that serve drug users to meet their quotas. We must work towards transforming laws and law enforcement officials to become bridges to connect people who use drugs to life-saving health services. We hope, Mr. Chair, that this session will finally consider an approach that treats drug dependency as an illness and not a crime, that makes harm reduction available everywhere, and avoids prison sentences for non-violent, victimless crimes. Together, these steps will be a massive jump towards ending AIDS and much closer to a more just and humane world. Mr. Chair, so let us unite the power of the AIDS movement and the international movement for drug control to address these issues and to complete this task. Thank you, Mr. Chair.
All this is a build-up to the 2016 UN General Assembly Special Session on Drugs, UNGAS 2016 as it's called. The last General Assembly Special Session on Drugs was held in 1998. Now obviously a lot has changed since then, both good and bad. Advocates of harm reduction and drug policy reform have a real opportunity to make a significant impact on the international drug control regime. Treaties must be reinterpreted or modified to give support to effective approaches. It is only because advocates and organizers have been at work for the past decade and a half that we even have this limited seat at the table, so we have our work cut out for us. So let's wrap up our coverage of CND 2014 with some words from the actor and comedian Russell Brand. Brand appeared on the 19th at a press conference at the UN Center in Vienna, which had been organized by the International Drug Policy Consortium. He kept it clean for the cameras, so here he is.
We all want a solution. Like, I'm not standing here saying people that use drugs should be coshed and lifed off. Let people do what they want. I'm a person who's like, I'm into personal freedom. If it's not a problem, then it's not a problem. But where I have a constituency and where I have personal experience is people that are using drugs to deal with emotional, spiritual, personal issues, and those are the people that I can most clearly represent. Of course I'm interested in your personal human rights the same way as I'm interested in everybody's personal human rights and their right to pursue happiness in whatever wacky crazy way they want to, as long as it don't harm nobody else, you know. But for me the bigger problem is like the serious issue, mate, is people are getting like butchered left and right all over Mexico. People are getting hung in Pakistan and all over Malaysia for something that's not a moral issue. It's not a moral issue. It's a health issue. We got to focus on that. We can't get caught up in infighting, mate, and getting all that Judean People's Front bullshit.
Okay, time is such that we have time for two more questions. The gentleman at the back here and the lady at the back there have been waiting.
Is that me? Donald McPherson with the Canadian Drug Policy News. And Vancouver, from Vancouver, Canada. Vancouver, Canada had a serious public health disaster during the 90s with an overdose crisis, an injection drug use crisis, and an epidemic of HIV among injection drug users. And one of the responses to putting in place a comprehensive approach, health-based approach, was implementation of North America's first supervised injection room. And I noticed in the past year you visited that, and I was wondering if you could say a few words about your visit there.
I've got nothing but respect for Liz Evans and the Insight program, which you're speaking, which is a harm reduction program. She's provided like safe places for people to use intravenous drugs and also gave them access to recovery. She described it as a low entry point model where that was accessible to everyone. I believe there's some cooked up hocus pocus financial indiscrepancy being investigated as part of what I would glibly describe as a global conspiracy to criminalise anyone that wants to make a social advance in the area of addiction and drug using. And now Liz has lost her job and the facility has been taken over by the government, which I would imagine probably the first step of annihilating the facility. I see the work that they did there. I can see why it would be a threat to a Conservative government. They were interested in social enterprise. They were interested in inclusion. They were interested in compassion and tolerance and helping people with a problem to get better. And as our man here, who's one of the most motivated drug addicts I've ever met, keeps continually saying, if people want to just use drugs safely, then, let them. So, I can see that that's a threat to the core values of a society that needs continually to have scapegoats to persecute and prosecute and judge to, to sort of galvanise voters in a broad neoliberal consensus. Okay. She was wicked, that Liz Evans. I totally support her. I wish I could do some more for her.
Okay, and the final question, I think it was a lady over to the left here.
Hi, my name is Lisa Campbell. I'm also from Canada, Canadian Students for Sensible Drug Policy. We really appreciate your support of Insight. I just want to ask you about your opinion on cannabis legalization and if we should take a similar approach to legalize and regulate other drugs.
I completely agree with the legalization of cannabis, and I think we should legalize and regulate all other drugs. That's what I think should happen globally as quickly as possible. Shouldn't wait for 2 years, just get on, do it now. I mean, I don't know how you push these things through. I'm sure there's some paperwork, is there?
Okay, I think that I'm safe in saying that's the first time we've heard that in these rooms. Okay, so the end of the okay, we will take one more question because a very esteemed colleague has pointed me that way. Sir, you have a very short question.
Jim Cleary from the University of Wisconsin. Some 6 billion people are without simple pain relief because of the collateral damage of the war on drugs. Could you comment, Russell?
Another serious consequence of this war on drugs. How can you have a war on an inanimate object? All these wars on things that aren't real. We've got to stop wars on terror, wars on drugs. Of course people need access to pain relief. I realise it creates international complications with getting pharmaceutical aid across borders because of this ridiculous war on drugs stance. Yeah, you highlight a very, very important issue, and that's another of the problems that could be eradicated by reviewing this global stance on drugs and adapting a stance of tolerance, compassion, and not just bloody humanitarian values that I think we all agree with anyway. I think we all agree within ourselves, don't we? We already know the answer. Knowledge is acting on wisdom. I don't know why we're pretending that we don't know what to do. It's like a bizarre facade. It's peculiar that we would do this as human beings. Why are we? It's confusing, Mike.
Okay. On that suitable note, to end the organised thing, why are we doing this as human beings? We can all go away and ponder that. The one thing we actually, the question that came is actually quite apposite because as I said at the start of this event, we are on the start of a journey for 2 years to the UN summit in New York, and one of the things we can make a massive difference to is the availability of essential pain-killing medicines to people around the world. There's a lot of political support for this, there's a lot of possibility to improve it, and it's something we should be ambitious about over the next 2 years. Only one of the things. So with that, we'll end the group end of the press conference.
Well, while we still have a few minutes left in the podcast, let's take a quick look at some news from this week. Research into use of cannabis to treat post-traumatic stress disorder in U.S. military veterans is a step closer to being conducted. The Food and Drug Administration has finally signed off on the research. All that remains is for the Drug Enforcement Administration to give its approval. And no, they do not have a deadline. The research is to be conducted by Professor Suzanne Seisley of the University of Arizona. A year after adult marijuana possession was legalized in the state of Washington, official statistics seem to show that the number of adult marijuana possession arrests has dropped. According to the ACLU of Washington, quote, the ACLU of Washington's analysis of court data provided by the Administrative Office of the Courts reveals that filings for low-level marijuana offenses have precipitously decreased from 2009 to 2013. 2009, 7,964. 2010, 6,743. 2011, 6,879. 2012, 5,531. 2013, 120. The data strongly suggests that I-502 has achieved one of its primary goals, to free up limited police and prosecutorial resources. These resources can now be used for other important public safety concerns, says Mark Cook, Criminal Justice Policy Counsel for the ACLU of Washington. The data also show that the number of court filings for other drug offenses, including felony marijuana charges like growing, selling, and possession of large quantities, have stayed relatively constant. Court filings for both marijuana and other drug offenses by individuals under age 21 have dropped to a lesser degree in recent years, indicating that I-502 is likely not the main driver of those decreases. Although the overall number of low-level marijuana offenses for people aged 21 and over has decreased significantly, it appears that racial bias still exists in the system. An African-American adult is still about 3 times more likely to have a low-level marijuana offense filed against him or her than a white adult. Initiative 502 legalized possession of up to 1 ounce of marijuana for adults 21 and over. However, possession of more than an ounce, but no more than 40 grams, remains a misdemeanor. Exceeding the 1 ounce threshold is a likely explanation for the presence of 120 misdemeanor filings against adults in 2013. End quote. So we are seeing fewer adult marijuana possession arrests, but we're still seeing the racial bias, which isn't surprising. Legalization isn't going to solve the problem of racially biased law enforcement. We have a lot of work to do to move social justice forward and to end the drug war. It's not just about cannabis. Well, that's it for this week. Thank you for joining us. You've been listening to the Drug Policy Facts Podcast. I'm Doug McVay, editor of DrugWarFacts.org. The Drug Policy Facts Podcast is a production of Common Sense for Drug Policy and Drug War Facts. You can find us on the web at DrugWarFacts.org. This podcast is hosted through podcastgarden.com. The URL is podcastgarden.com/podcast/drugwarfacts. You can find links there to listen to or download previous episodes as well as subscribe. And if you are a subscriber, thank you. You can follow us on Twitter, where we're at Drug Policy Facts. Also check us out on Facebook and give the Drug War Facts page a like. Share it with friends. We'll be back next week with more news and commentary on the drug war. For now, this is Doug McVay saying so long. So long.